Your amygdala is a small part of your brain, but it has a big job. It's a major processing center for emotions. It also links your emotions to many other brain abilities, especially memories, learning, and your senses. When it doesn't work as it should, it can cause or contribute to disruptive feelings and symptoms. Amygdala is a small, almond-shaped structure inside of your brain. It's part of a larger network in your brain called the limbic system. When it comes to your survival, your amygdala and limbic system are extremely important. These are parts of your brain that automatically detect danger. They also play a role in behavior, emotional control, and learning. Fear is the main emotion that the amygdala is known to control. That's why your amygdala is so important to survival. It processes things you see or hear and uses that input to learn what's dangerous. If you encounter something similar in the future, your amygdala will cause you to feel fear or similar emotions. However, research shows that the amygdala contributes to more than just anxiety or fear. It also plays a role in aggression, learning through rewards and punishment, handling and using unconscious memory, which allows you to remember how to do certain things without remembering how you learned them, like riding a bike or tying your shoes, social communication and understanding, including how you interpret someone's intentions from how they talk or act, emotions that relate to parenting and caregiving, emotions we connect to memories, learned behaviors related to addiction. Your amygdala is part of your temporal lobe. It's a paired structure, meaning you have two of them, one on each side of your brain. Your amygdala sits near several structures that carry information from your senses, especially smell. Your amygdala also connects to brain areas that process vision and hearing. Vertically, your amygdala is nearly level with your eyes. If you touch your fingertip to the temple of your head and point directly toward the temple on the opposite side of your head, you're pointing at your amygdala or very near it. It's nearly halfway between the center of your brain and skull. The amygdala gets its name from its shape. Amygdala comes from the Greek word for almond. Most brain tissue is pinkish beige when there's blood circulating through it. The amygdala is slightly darker in color than the surrounding brain tissue. The amygdala is small, though its size can vary slightly depending on the overall size of your brain and other factors. The average amygdala is about the size of a shelled peanut. Most conditions that can affect or involve your amygdala are psychiatric or neurological. Many amygdala-affecting conditions fall under both categories because disruptions in brain function commonly affect your mental health. Mental health conditions can include anxiety disorders, intermittent explosive disorder, Kluver-Bucy syndrome, mood disorders, panic disorder. Brain-related conditions that can involve the amygdala include Alzheimer's disease, autism spectrum disorder, brain cancer, epilepsy, and stroke. Several imaging and diagnostic tests can check for issues affecting your amygdala. Some examples include magnetic resonance imaging, MRI, scans, positron emission tomography, PET, scans, electroencephalogram, EEG, and magnetoencephalogram, MEG. Other tests are also possible, depending on your symptoms or what your healthcare provider suspects might be causing them. Your provider can tell you more about possible tests, which ones they recommend, and why. There aren't any treatments that specifically help the amygdala. Instead, treatments target specific symptoms or conditions related to it. Treatments can vary widely and include mental health therapy, medications, and brain surgery. A treatment that helps one condition may not help others. Your healthcare provider is the best source of information about possible or recommended treatments. You can do several things to take care of your brain, including your amygdala. They include reach and maintain a weight that's healthy for you, eat a balanced diet, protect yourself from injuries, and manage chronic conditions. Amygdala damage disrupts your ability to feel fear or learn from it. While that might sound like a good thing, fear can be valuable. It's how you learn to spot danger and protect yourself. If you suspect you have damage or a problem affecting your amygdala, you should talk to a healthcare provider. They can help determine if there's an issue, run tests to look for damage to your amygdala, or refer you to a specialist who can help further. Like many functions in your brain, your amygdala isn't something you can control directly. You need it for many reasons, not just fear. But it can disrupt your life if it causes excessive fear or anxiety, or causes those too frequently. Some things you can do to help counter the effects of anxiety, fear, or panic include: don't neglect your mental health. Learn how to deal with panic attacks and find ways to manage stress and anxiety. Thanks for watching this video and we'll meet with another exciting video.